I'm glad you're here. On this channel, we'll break down and simplify all things medical. My name is Irene Oira, and thank you so much for tuning in. Today, I'll be giving you 5 free medical advice I think you ought to know. Firstly, the moment you decide that you'll be visiting the hospital in the next few hours, or maybe the next day, or in a few days to come, depending on how you're feeling, make sure that you have a brief idea of your condition. Then go share the idea with your medical personnel when you visit the hospital. Mind you, don't ambush the medical personnel. Just go share so that you can have a wide scope about your condition. And then it will also give you enough time to consult your doctor, because remember, you have paid your consultation fee. And what is consultation? When you don't have questions on the table, when you don't have to make any inquiries about your condition. So don't be that person who is just fed with information and you just walk out of the consultation table. Then later on, you come complaining that maybe the doctor was in a rush, the person was brief to the point, that you didn't love the consultation time, yet you don't have something on the table. So to make good use of your consultation time and your money, make sure that you have something on the table to discuss with the doctor. Remember, the person attending to you doesn't know everything. Number 2, they could have practiced about it some time ago. Then another reason is because medicine is diverse. Of late, there are some new findings in medicine, and these findings keep coming up each passing day. So there's no way that someone could be knowing everything happening in their field. Secondly, and this is so common, your headache could be due to lack of sleep or lack of water. Thirdly, if you suspect that someone has symptoms of stroke or heart attack, kindly call the hospital or the medical facility that you think of taking them early in advance, or on your way to the hospital, so that the hospital may be prepared for a life-saving situation. Number 4 advice: don't stop using the medication because you have used it for a long time and you now feel you are feeling better. Just stick to the treatment plan, finish up your dose irregardless. The 5th and last advice for today's video, this mostly touches on women, so you've heard a lot about ovarian cysts, and in today's world, this is a very, very common condition. So how do you differentiate cysts from the normal cramps? Normally, cramps are involuntary muscle contractions, and the contractions might range from mild to moderate depending on a person, and mostly happens pre-menstruation or during menstruation. So if you get cramps that are extremely painful and get worse as you menstruate, kindly visit the hospital. It could be ovarian cyst.